I see that, and we have an exciting conversation happening today. Thank you for attending this meeting discussion. Is sponsored by several people, several organizations, including the Zero Project, Counter Narrative Project, HIV Racial Justice Now, Thrive SS, Positive Women's Network USA, and the US People Living with HIV Caucus. I'm Andy Spieldenner. I'm the current chair of the US People Living with HIV Caucus, and welcome. We also have Vanita Ray is with me from Positive Women's Network, and our panelists include Kelly Dorsey, Dazon Dixon Diallo, Jorge Ayala, and Larry Walker, who will all introduce themselves. I'd like to start by mentioning that we have a Q&A box on the bottom of this Zoom. So if you have questions, click on the Q&A box instead of the chat. We do have a chat that is that you can use and speak to everybody. Vanita will be on it to answer any questions. But if you have specific questions for the panelists, please use the Q&A box because that makes sure that we'll get it. So with that, I'd like to start with some background before we enter the conversation. Let me share my screen. Let's see, where is that?
A quick question. Mark King wants to know if this webinar is considered on the record.
Panelists, do you mind being quoted?
Not at all.
Sounds fine.
No, I don't mind at all. This is Larry.
Kelly?
No, I'm fine with being quoted.
Great. So Mark, you're welcome to quote. Okay, let's start with some background. So these are our collaborating partners on this. So many of you may have heard that AIDS 2020 was announced, and it was announced to be in San Francisco / Oakland, a Bay Area conference. And there's been some organizing around it. Many of us are very active in raising questions about how this was chosen, why it's going to be in the US, and whether or not it's appropriate to be in the US. As you may have noticed, the political climate in this country is deteriorating and continues to have several issues that continue. I wanted to show briefly, see if it'll come up. Dr. David Malbranch talking about, that's not gonna come up. Sorry about
this.
That.
Is introducing quite well the next speaker and the topic of the next speaker, who is going to talk about making the treatment cascade work.
And so this is
vulnerable and key population. This presentation will be given by David Malbranch, probably a French pronunciation. David is a board certified internal medicine physician and expert in men's and LGBT health, as well as the prevention and treatment of HIV and sexually transmitted infection. David is an associate professor of medicine at Morehouse School of Medicine in Atlanta, and he is an experienced qualitative HIV behavioral prevention researcher. In 2015, he published his first book.
Mention, along with the protest that we just saw, that if people in this audience can make their voices heard, we do know that the policies in the United States will make it inhospitable for folks coming to San Francisco in 2020. So make your voices heard with regards to possibly changing the city to the IAS membership. So again, my topic this morning.
So I think we see there that there's been organizing. People are again having this conference. I want to raise some questions about why it's an issue. We do have some people to talk today, but briefly, what is AIDS 2020 for All? We're a movement of advocates and networks. We have come together to raise questions about how this conference is chosen, as well as whether we can move it, and also whether we want a different kind of meeting. How can we bring communities together? In particular, we want to raise the issue that there are active travel bans on sex workers and people who use drugs, as well as people from 5 majority Muslim countries, North Korea and Venezuela. We're now in the US demanding 5 years of social media handles as part of the visa application process. We've also seen, as recently as this week, that people's visas, or even US citizens, are having problems with their passports, particularly Latinos on the border. And so we want to raise these issues and, as a community, figure out what we can do next. Here's some examples of entry restrictions, health-related grounds, anybody who has a communicable disease of public health significance, possibly, as well as people who are assumed to be controlled substance traffickers, or is related to somebody who could be inadmissible under cause. There's been a huge movement against sex workers entering the country, as well as people who use drugs. So with that, I'd like to turn it over to, let me see if I can manage this. I'd like to turn it over to our panelists. Vanita, do you want to start the conversation, have them introduce themselves? I'll take over the chat.
Yeah, one of the things we just got in the chat box is that, folks, if you're not speaking, can you put yourself on mute because there's background noise. But good afternoon, everybody. My name is Vanita Ray, and I am with PWN, and I guess that's just for the panelists. But I'm really excited to be here. And I guess we want to go briefly, a couple minutes, and let each of the panelists introduce themselves. And, you know, we can talk a little bit more what brings you to this space, but just quickly, so folks out there, at last look, there were 56 participants. Let them know a little bit about yourselves, and we can move on with the questions from there. So who wants to start?
I'll start. This is Larry.
Oh, Larry.
Hey, this is Larry Scott Walker in Atlanta, Georgia. I'm representing Thrive SS Incorporated. Thrive stands for Transforming HIV Resentments into Victories Everlasting. We can be reached at www.thrivess.org. And that's it. I'm from Baltimore, Maryland, and I live in Atlanta, Georgia. Thank you.
Thank you, Larry, for spending time with us. Next.
So this is Dazon. I'm going to keep it in Atlanta for a second. Dazon Dixon-Jello with Sister Love. And hey, Larry. And just shouting out to everyone who's in Atlanta or going to be in Atlanta this weekend, either for Black Pride or House in the Park, or if you're going to be in Savannah for the Healthy Love Youth Advocacy statewide summit. Welcome all. I'm happy to be a part of this conversation today. Thanks for inviting me.
And we are happy you're here, Dazon.
Hi. I can go. This is Kelly. I'm in New Orleans. I am not with a specific organization. The reason why I'm on this call is because I was the person that organized sex workers towards the International AIDS Conference in 2012 in DC. And I did a lot of work trying to move the conference and working with sex workers and people who use drugs, and the fact that our communities were disproportionately impacted and we couldn't get in the country, and worked with was the organizer for Global Network of Sex Work Projects to organize International AIDS Conference 2012. And so I'm hoping to talk a little bit about the impact on sex workers and people who use drugs.
Thank you, Kelly. Glad to have you. And George.
Thank you, Vanita. My name is Jorge Ayala. I'm the Executive Director of Impact Global Action for Gay Men's Health and Rights. We're based in Oakland, California, so greetings from California. My organization was founded in 2006 as the Global Forum on MSM and HIV at an international AIDS conference, because a group of activists were really quite upset by the relative silence at that time on issues focused on gay men and other key populations. And since that time, my organization has been kind of a needle on the side of the International AIDS Society on issues concerning gay men, sex workers, people who use drugs, and transgender people. We advocated strongly against bringing the conference to the Bay Area when we learned that the International AIDS Society was considering the Bay Area for the 2018 conference. And together with the Global Network of Sex Work Projects, the International Network of People Who Use Drugs, we were successful in helping our colleagues in Amsterdam to beef up their bid and to move the conference. And when we learned earlier this year that the Bay Area was on the short list, we also advocated very strongly with the other global networks to push the IAS to change its decision, and those efforts went nowhere, and hence we're here to have a conversation. So I'm really pleased to share this time with all of you, and I look forward to the discussion.
Well, thank you all and welcome to our forum. I'm going to go through a few questions, and I guess one of the first questions for people that are new to this and to kind of just set the stage for why we have these kind of conferences. Maybe Georgia Dazon can tell people a little bit about what is IAC, and some of you referred to what happened in 2012. What was that? What is IAC, and what are you guys referring to that happened at AIDS 2012? Why do we need this?
So this is Dazon again, and thank you for that. I think it should be important. I think it should be added to the introduction as well, that a part of why I'm here is because I absolutely value the global space that the International AIDS Conference creates, and that's important to me, particularly as a Black woman living in the Deep South, that for the entire 34 years of of my own participation in the dual work that I do around HIV and sexual and reproductive justice. So it's not really dual. The intersectional work that I do is that connecting my experiences, our experiences in the Deep South with those experiences in the Global South. And until recently, these, wonderful modern ways of being able to communicate across all of the continents. Before that, the only way to get to learning from each other and meeting and growing in our power as advocates and activists, and also being able to just globally work the movement, it was important to have this meeting. So it's always been important, and it's always been critical to bring voices that have not necessarily been traditionally included, the issues and the experiences as well. And so, for example, fighting years and still on end to ensure a diversity of representation, not just in who attends, but in who represents, and who's in the research, and who's on the decision-making bodies around not just this meeting, but around the entire, AIDS Inc. And so I'm saying that because where the conference gives us the opportunity to do this is there's another way of thinking about the movement or the resistance to AIDS 2020 in the US. And I love it. I think it's JD Davids who gave us this way to think about it. But another name for our group is Power Shift, because we're not just talking about some grievances with a particular location of a meeting, we're actually talking about the whole picture. We're talking about the much larger picture of who decides who is in and who is out of these conversations and these decisions. It starts with making a decision to go to an area that I think is, we'll probably talk about some of our issues of resistance in a minute, but I think that that's most important. Historically speaking, and I think that this is another part of the conversation, and George has some more intricate detail and history with this as well. But what's also been important is the community voice in a space that's originally and at the outset designed and focused primarily on the science and on the research. And it, of course, through movement building and through activism has always been important to make sure that all who are impacted within and about the epidemic have a place to have their own expertise brought to the table, their own lived experiences. And so community advocates, people living with HIV, folks in what we now know as the key populations, everyone deserves a space when we're talking about having an international conversation about HIV and AIDS. Nothing about people without people will work for people. And so that has been the main goal of community involvement in the International AIDS Conference, is to expand the inclusion, to diminish the exclusion, and to shift the power in the representation. And there will be a next conversation, because I think we've come full circle, for example, around how that inclusion has happened over the years. So I think it's now been at least 6 conferences where there has been a separate and connected space called the Global Village that's been attached to the traditionally larger registration expensive meeting known as the International AIDS Conference. So paid or scholarship people go to the International AIDS Conference, and then the Global Village has been free. We fought for that so that there was a way in a resource restricted way. You don't have money for everybody to pay to go to a conference, understandably, but where we could have more activism and more advocacy and more creative space and more interaction, and a place where we could include research literacy as much as community literacy. So the Global Village had its purpose at the time, being a free and open space. I think we've come full circle now to revisit how we have separated ourselves and how that separation has given space for the International AIDS Conference to now become more exclusive, where what we've been fighting for in terms of the inclusivity, we have a next challenge. And now that challenge is not only in 2 separate spaces, but in 2 separate cities. And I think that that's also a part of the conversation.
Vanita, if I can add to Dizan, it's hard to add to what Dizan has just shared, because I completely agree with many of her views and sentiments about this issue. The only thing I would, maybe add to this is that, the way that the International AIDS Society and the International AIDS Conferences began, and this is the history that was shared with me, because I wasn't part of how this all got established, but it was always imagined or envisioned that the International AIDS Conferences would be a space for equitable information sharing, where all stakeholders came to a conversation, to opportunities for information exchange, and to kind of the equitable deliberation of knowledge and science. And I think the conversation today reflects how far astray we've gone from that initial vision for an international AIDS conference. And at the time, I think there was a recognition, a very palpable recognition, that the HIV response is best when we can all come together across sector, across communities, to put our thinking hats together to strengthen the response. Mm-hmm. And one of the things that I think have occurred in the many, many years of our work in HIV is that, you know, there's been kind of the domination of a biomedical frame. And with that, the assumption that those tools are best in the hands of clinicians and professionals. And then in turn, that's meant that, you know, the discourse and the place where power resides are with professionals, with clinicians, with researchers. And I think this discussion and the debate is an opportunity for us to really disrupt that and to change that and to ask a basic question about who does this belong to?
Mm-hmm.
Vanita, you're on mute.
Thank you, George. I appreciate you and Dazon. I want to remind folks if they have questions to put them in the Q&A box versus the chat box. And I did see a couple, but I wanted to get a couple questions in because some of these questions go to alternative sites. And before we get there, I want to kind of talk about, get Kelly in the conversation as well. So please put your questions in the Q&A box, and then Andy will kind of nudge us when we need to get there. So yeah, historically, spaces for all of us, we've kind of migrated to the global village, which kind of has allowed for this separation is what I'm kind of hearing, so that the main conference can kind of lead us where they want us to go because we're in the global village when it's really the whole space should be for us. Is that kind of what I heard, Tezan?
Well, yeah, well, there's the whole space, and let me be clear, because I do think that there's a very worthwhile conversation on why that space for finding affinity among all kinds of representations is really important. What I think I'm trying to say is that with the original intent, that there was more cross-directional engagement at the beginning of this process. So even if there's still an IAC and a global village for all of the different kinds of logistical and financial, as well as social, for lack of a better word, reasons, that what we moved away from is that there was a lot more coordinated interaction where things that were happening inside the International AIDS Conference literally were engaged within the global village with bigger talks, with the new news, right now it's almost all virtual in terms of extending the video. So if you want to see a big plenary from the IAC and you're in the global village, you can do that. But also there are lots of spaces where there's lots of data, new science, new topics that are presented, that if those people don't come individually or some of those discussions aren't brought into the global village, then people miss out. So, and likewise, there are lots of things that happen in a community space that if they're not transferred over into the IAC, then the research and the science and that more structured conversation misses out. So being, I think, a little bit more intentional about, I can remember like for 2012 that there was almost a complete separation because I had the privilege, for example, of sitting on a review committee for abstracts. And there's a complete separation of the review groups that are looking at the tracks of the IAC and the groups that are looking at the tracks of the global village. And I think that was probably one of those moments where I realized that there should actually be there should be a point where there's an intersectional conversation to see what issues might need and what speakers or presenters might need to be cross-shared in both spaces. Something just as practical as that, but we haven't had open conversations in terms of that. But I think one of the other important pieces about this is back to, most importantly, the decision-making process and the process for how, where, when, who, how much, and all of that around the IAC takes place. And that if it remains as insular and exclusive and in some conditions secretive as it has been, then there's not a lot of sustainability in the IAC, and eventually there's going to be a lot less and less relevance to certain groups and communities. And I, for one, as someone who I value my membership in the IAS, I value the opportunity to have these conversations in different places. But I also think that change is important when we recognize that what we've been doing no longer serves us. And so this is what this conversation is about. This is why there either will need to be an alternate space so that that kind of conversation can continue along with all of the content that's important for those meetings, but it also must continue inside the IAC and inside the IAS. So whether that meeting takes place in the US in 2020 or not, there will be continued advocacy and activism about the location and about the process and about the issues around shifting the power that we have concerns about, especially with regard to the representation, the inclusion, the support, the leadership, the acknowledgement, and the respect for people in the key populations that even right now are not included, especially when it comes to movement and representation.
Thank you. And cost, I'm glad you brought that up. I'm going to get to my second question, and Kelly, maybe you can lead off, and I want you guys to think about this issue of cost as well, all three of you. How would the AIDS 2020 in San Francisco, the Bay Area, affect your constituents? And clearly cost is one of those too, but how would that location and siting for AIDS 2020, and Kelly, maybe you can start this off, affect your constituents' ability to be able to be there?
Sure. So I think that at least with sex workers legally can't get in the country if you've traded sex in the last 10 years. When you go and you apply for a tourist visa, you actually have to say whether or not you've traded sex. And so that actually eliminates key population sex workers. And then also drug users have to answer a question that's very similar. So they also wouldn't be able to get in the country. What ended up happening in 2012 is sex workers and drug users had alternative conferences outside of the country. So people who use drugs actually ended up going to Kiev, and sex workers ended up going to Calcutta. And you know, the amazing thing about the sex workers going to Calcutta, they ended up having 650 sex workers from across the world going to Calcutta. When they got to the airport, they had signs that said, "Welcome sex workers." They met with legislators, the union there, the sex worker union there, 65,000 sex workers. As it relates to the 2020 conference, sex workers won't be able to get here. So there's no way, I mean, one, we have to already start planning another conference. So whether, like we did in 2012, there's no way under this administration that sex workers can get in, drug users can in, but I also think that both middle and low income countries also won't be able to get in. And then we have ban on certain Muslim countries, and then Venezuela and North Korea. And so the conference in 2020 limits pretty much the global South and key populations. And so what we're looking at is a conference that is not going to, so while researchers and people that are more resourced will be able to get into the country, and talk about key populations and talk about folks that are most impacted by HIV, key populations, global South, and those who are most disproportionately impacted will not be able to get here, and so are left out of the conversation, but are having people talk about them. So I think that at this point, at least sex workers, I know we're gonna have to have something in another country. The complicated piece around what happened in 2012 is the alternative conference was in Calcutta, and we tried to do live transmission, but we were 12 hours apart. So sex workers, it was 7 a.m. here, and I think it was 7 a.m. in DC, and it was like 11 p.m. in Calcutta, and we had like some live panels and stuff, but it's just not feasible. One, sex workers don't really do stuff at 7 a.m. in the morning. It's just too early. So we really did not get to do the building and the bridging that we wanted to do with our international like partners. And I think the question here now is like, are we going to continue? And IS is continuing to do the same thing with not actually caring about key populations? And how do we actually hold them accountable this time? Like we saw what happened in 2012. It's actually not okay that sex workers and drug users are separated apart. I have no clue what it means now that we're talking about pretty much the entire global South. Unless you have some sort of wealth or you're a researcher or something, you're not going to be able to get into the country. And then the Muslim ban and ban on those other two countries, it literally is going to be a conference of, it's going to be a Western conference mostly, and then a conference without key populations, which is a conference of privilege. And I will say, I saw someone had posted something about alternating the conference between the global South and the global North. And yes, in Durban, there was a decision to do that. And I'm unsure. I remember when organizing in Amsterdam, we did not have conversations, or I did not have any conversations with IAS about that. But it is, IAS did make a commitment to alternate between the global South and the global North. And we were just in Amsterdam, global North, and now we're going to San Francisco, which is also the global North. So we're being not just unaccountable to the global South by having the conference again in the global South, which it should be, but also they can't even come to the conference. So we've got to actually do something in which we're accountable to those who are most impacted, but those also that we have privilege over.
I think, thank you for that, Kelly. I think this points to, I mean, the thing that IAS will always say back to us is no other city bid or no other city has capacity to host. But I think that reflects still yet again the need for us to restructure and rethink these big multi-million-dollar conferences. And for those of you who've never attended an international AIDS conference, the scale of these things are overwhelming. It's 15 to 20,000 people in a conference. And for global Northerners, the registration fee ranges from between $800 and $1,000. Mm-hmm. And that does not include costs of spending the week in the host city, hotel costs, airfare, local transportation, all of those things. And when you add all of that up, you're talking about, a multi-million-dollar enterprise. And really, you think about, we're in 2018. Do we really need those huge trade show style multi-million-dollar conferences, or can we be creative and imagine something different and something that's more accessible and that would position all stakeholders in an equitable way, in an equitable exchange of information and knowledge and deliberation of science?
George, can you talk, I guess, a little about, you talked about the money, how will this conference impact your constituents? And you highlighted something we've been trying to talk about, is that some of these conferences in IAC is kind of priced anyway. How will it impact your constituents?
Well, my constituents live in the global South, and in many countries that will be banned from entering the U.S., or people from countries who will be banned from entering the U.S. I should also remind folks here that, gay men and other men who have sex with men are also men who use drugs and are also men who sell sex. And so, our communities are intersecting, and we have big concern that significant proportions of our constituents will not be able to enter the U.S. And if they can, will not be able to afford to attend the conference or to participate or, be in the Bay Area, which is super uber expensive.
Mm-hmm, mm-hmm. And Kelly, can I ask you a quick question? And before I get back to Dazon, can you explain how the issues of FOSTA and SESTA impact women or sex workers entering into the U.S., or what impact that will have on a conference organized in San Francisco?
Well, so it's interesting that you asked that, because right now Electronic Frontier Foundation has filed a lawsuit trying to determine what organizations that have anything about sex work on their websites are impacted. So right now, the law is so broad that it actually impacts, sorry, there's a storm where I'm at. It impacts sex work organizations, anybody that has anything on their website related to sex work. It's not just organizations that have something, it's not just organizations that allow providers to advertise, but it's also foundations that like ask organizations who want to apply to, for sex work or want to apply for like a sex work grant, or that it impacts them. It also impacts, so EFF is suing, Woodhull Foundation is one of the people that are suing. They're a conference and a sexual rights conference, and they're suing because what they do is they get abstracts on their they put abstracts on their website, but they also ask for sex workers to apply. So technically right now it's so broad, we're waiting to hear an initial determination from the courts, but right now even International AIDS Conference, they're in the same boat as Woodhull Foundation actually, in which if somebody, it's very broad, so if they have abstracts on there and they want sex workers to apply, they can be impacted, and vice versa. And so we're hoping that the law gets narrowed. It's up in the air right now. I've put some folks on this organizing committee in contact with the lawyers, but I think that there's going to be determination in the next month or so. But I also will say that, again, like another reason not to have this conference in the United States is we don't actually think about how United States laws impact folks globally, and the fact that like our laws are transported literally across the world, and SESTA and FOSTA in one fell swoop literally impacted sex workers across the world. So sex workers in Australia, sex workers in Canada, I know for a fact, have the same impact of homelessness, of increased violence, of like increased people contacting them who want to pimp them. So that has increased literally across the world in one fell swoop from like a United States law, versus normally we actually just push other countries to adopt our laws. And so I actually think that in and of itself, we should not actually be having conferences in this country when our criminalization actually impacts countries, and we actually force countries to adopt our laws. Otherwise, they will not get US funding. So it's up in the air. I will definitely keep people in the loop about what happens, but I also think that it would be worth the International AIDS Conference minimally contacting Electronic Frontier Foundation and finding out why one of the core people that has filed a lawsuit is a conference.
So, did you have something else to add, Dejan? Go ahead.
Yeah, actually, and I'm sure no matter where the IAC goes, you could probably find a long list, but of reasons to be somewhere or to not be somewhere. But I think it's when it comes to the United States, because the US, especially as a government, acts more equal than everybody else, then they need to be in these kinds of instances treated more equally in terms of the power dynamics in the global space. And so I'm saying that because there's a much longer list of reasonings that go into why. And it starts with the human rights considerations around inclusion, around representation, around economic privilege, around race, gender, all of the issues around equality and equity. But even from an epidemic standpoint, and from, I would say, just in the HIV, the public health conversation that the IAC represents, I think there's also, this is not the time to have a message come out of the conference from a place that is this close, if not already there, to touting the end of their local epidemic. And the reason I say that is we have to think about the impact of one message getting taken, getting spread to the non-HIV savvy world, including our politicians and our legislators, to hear that you know, in one US city, it doesn't matter whether it's San Francisco or Oakland or anywhere else, that they have ended their epidemic, that extends to the rest of us, them understanding, well, the epidemic is over. And so you then see legislators begin to wonder why we need the funding for these kinds of conversations, why we need the specific legislation for healthcare and for prescription coverage and for facilitative services and social determinant preventive needs that are all connected to HIV would then be on what I would call a slippery slope to negligence in with regard to the response. The other thing is that it's not going to be affordable for people inside the United States to be in that part of our country. And so that too is not only a global South consideration, but it's much larger than that. The notion that we are having to plan a separate meeting is empowering on one hand, because it shows that resistance is real. And that I like the way we're having this conversation, because where the 2012 we really supported but witnessed our sex worker communities and allied groups have a separate meeting, because they're standing in the place that so many of us could have and should have been standing in 2012. 2020 gives us that opportunity to stand together across a bunch of different places where people are not being included in a lot of the different ways that decisions get made. And so I want to urge us in this conversation to make sure that when we get to these questions and answers around where the meeting goes, is that while there's a small group of folks that are looking at all of the parameters and all of the moving parts that go into planning that we still be pretty open as possible in terms of hearing from people about the locations that we're considering. That's the first part. Because when George asked the question about whether or not we need to spend the money, the reasoning, whether we choose that that's important and valuable enough to invest in, the fact that the process may be so secretive that there's not even an opportunity to look at how many cities can get engaged and can apply and who gets to be involved in that process is as problematic as having a question around whether the meeting is relevant to spend that much money or not. So those things are also really big reasons for me. And I think it's important for us to announce here that Women Now, which is our, we're not even going to call it the pre-conference anymore, but it has been our women's contribution to the global conversation. It's a summit on the intersections of HIV and sexual and reproductive justice for women and girls of African descent. Pan-African and diasporan. And it has been attached to the International AIDS Conferences for its first two iterations, but we're already very clear that we will not, cannot, ain't going to follow the IAC to the United States, at least not in 2020. It's an election year, people. And so it's the worst time in terms of the opposition driving and owning the media message from the farthest right and the deepest part of their bases that they can get to. And in that context, I'm not willing to help contribute and be complicit in, helping them tout all of the policies that we are against and showing why they think they're more important at that time. But Women Now has declared that we're not following to the United States. We are literally waiting to see where the alternate meeting will land and then make a decision of whether Women Now can follow the alternate meeting to where it's going to go, or if we are going to go to the plan for regional meetings in 2020 and go all in on ICASA for women and girls of African descent, which will be in Rwanda in December of next year. I'm saying that because I also think that the UN model is something that we may examine and offer up as we think forward towards how to spend the money on these kinds of conversations differently. Does it need to happen every 2 years? The UN model of the biggest global conversations usually happens every 4 years. And on the 3 years in between are some really robust, rich, and deep regional conversations that still engage all of the powers that be as much as the non-governmental community and civil society can. And those meetings, well, it's the UN. So those meetings don't usually have a cost to their registration, so it's a different thing. But still, just looking at different models is also worthy of our contribution to how things need to change.
Wow, thank you.
If I may, Vernita.
Uh-huh.
I just wanted to answer the question about the constituencies and how this decision impacts Black gay men living with HIV.
Okay.
So in preparation
Larry,
for this,
I keep forgetting Larry.
Yes, it's because you can't see this mug. You can't see this beauty. So,
Right, but I can see it in my mind because I've seen it once. It's forever.
No, but thank you so much. In preparation for this conversation, I asked the brothers of the Undetectables Atlanta specifically how they felt about the conference being in San Francisco, and there were, three main sentiments I would like to focus on. First, it was, why San Francisco? Do they even have HIV there? Similar to what Dazon said, I mean, San Francisco is very close to, controlling its HIV epidemic. And, our members felt like, from all of the trainings that we put them through and all of the literature that we released, that, the South is where the epidemic is. And to that point, even especially the global South, and to not have it somewhere that follows the epidemic seems to echo another point that the beautiful Dazon made just before me. It seems that to a lot of people in power, they view the epidemic as under control because the people that they care about are no longer, driving the rates of new infection. So that brings me to my second sentiment. It's a very timely sentiment, seeing as how the song "They Don't Really Care About Us" was released by Michael Jackson, and he just, his birthday was yesterday. It feels like they don't really care about us. We hear about, the rising rate of HIV rates in the Black gay community, especially amongst young Black gay men, and this decision just doesn't reflect that at all. And to another point that was brought up is that the affordability. I, as a person with a full-time job, can't afford to go and kick it in San Francisco for a week without thinking about all of my other, life deliverables. And we're talking about people who struggle to, get a meal to take with their ARVs, who struggle to get there I am, who struggle to get, the documents that they need to support applications that they need to get very vital services. So you're talking about getting these men to go to the West Coast to engage a conference where, I mean, frankly, I've been honored to attend the last two conferences, but I promise you, I've not sat in any sessions that reflected on how anti-Blackness, and especially the anti-Blackness that we experience in the States, affects viral suppression amongst Black gay men living with HIV. I know that there's not going to be a session at this conference about that. And to ask for people highly impacted by this epidemic to travel to spaces where they can get to the space, if they can get to the space, if they can afford to be in the space, if they have the literacy to even get a scholarship to get to the convening, their culture, their realities, their lives will not be reflected. And it seems, and this is my educated guess as a Black gay man living with HIV for over 10 years, it seems that, as Michael Jackson said, as Dazon said, they don't really care about us. They don't want us at these convenings. So I'm in full and 100% support of the alternative conference ideas, convening in spaces that do want us, in spaces that, in places that are safe for us. I talked about the anti-Blackness. It feels that even though I love Oakland and I love my people in Oakland, it seems that anti-Blackness is really rearing its head in the Bay Area. And I would fear for my brothers and sisters who are being asked to come to this area to support a conference that doesn't support them. But then also the anti-immigrant sentiment, that plagues our country. It's just not right for now. I would love to be able to uplift the lives and the struggle of the people living in Oakland, specifically around the disparities that they face. But at this time, emboldening this administration and all of the wrongheadedness around it, I just simply cannot support. And I will support any alternative conference that is a space that's welcoming, supportive, and healing for my constituency.
And Larry, before you go, and I didn't ask the others, and in their kind of final comments, I'm going to ask: do you consider this, the citing, the location, and all of that with this a racial justice issue? Can you speak just a couple minutes about the racial justice perspective around the citing, the selection, and all of that?
Well, yes, I really do consider it a racial justice issue. I mean, we are going to, or they are going, because I will not be attending, going to the whitest, like if not the whitest city, like one of the whitest metropolitan cities in our country. I mean, it's like not the place that I think about when I think about trying to, convene a diverse group of a racial group of people living with HIV. It is just like, this HIV disparity is a racial justice issue. I've been blessed to go to the last two conferences, and I've been one of a very few Black gay men from the States living with HIV. Outside of the doctors and the epidemiologists and the people in public health, where are the people that we're really doing this work for? Or are we really, or is IAS really doing this work for the people that belong to the undetectables networks? And that's the question that I'm having to grapple with. And it's not that hard. I really feel like I have my answer based on this decision to have the conference in San Francisco.
Yeah. Larry, I wanted to throw one more in here, in that I think, especially Larry, Vanita, and any of our other folks who are chiming in on the chat, one of the other things that I don't think have been a part of the conversation or the consideration, and this goes directly to the decisions, not only the decision making, but the short-sightedness of the decision making, the fact that, making that decision 2 years out is very important because of fundraising and all of that. Jorge Ayala's comments completely in consideration. Nonetheless, they look at this 2 years out so that they can raise the money for something like this, right? So right now they are 1.5, so give or take, years out, and they can make a tough decision now to move, and everybody thinks it's a fait accompli already, right? But if you think about the fact, I'm coming back to the fact that we're in an election year that year. I didn't know until last week that the Democratic National Convention, regardless of where it's going to be, will be 1 week after the AIDS conference. And so that, I think, is a whole conversation that we must consider in terms of the political ramifications of what we are engaging in and what's at risk for the world, not just Americans, in November of 2020. The other part of that consideration, though, is that I am not under any illusion, coming back to the racial justice question, I'm not under any kind of illusion that the current person residing at 1600 Pennsylvania in the leadership position is anywhere near done with his undo everything Obama list. And one of the things on the Obama accomplishments was the rescinding of the HIV travel ban. I have no illusion that just to get more of his base riled up, that will be one of the things on his list. The pushback from our own people that we consider allies, but who are in support of the 2020 conference in the Bay Area, the pushback is that, yeah, but Congress legislated against the travel ban, right? So technically it's a law. But then I would push back and say, well, technically, so is the law that protects people who apply for asylum in this country, that they shouldn't be having their children snatched from them and locked up and then deported when they are applying for asylum status. That currently is the law to which him and his executive office are flying dead in the face of and destroying families. So I have no faith that that law against the travel ban will hold faith in this person's presidency, especially when he's running for office. When that happens, the IAC and the IAS will then be on Front Street about, why are you holding a meeting in a country that has now deliberately removed the ability for people with HIV to travel freely in this country? And the next thing that happens is that funders are not going to want to touch it with a 10-foot pole. And so then the IAS will be in a position of thinking, do we need to move this meeting? And at that point, it will be too late. So these are real deep considerations that impact people locally. There's a racial component to it. There's a political component to it. There's a future component to it that, I'm sorry, 2020 is also about all of our futures with regard to the Supreme Court, if nothing else. So we've got, I know I sound like I'm like throwing everything against the wall. It's because it is about the entire kitchen sink, everything and the sink. And so moving this conference gives us, or the fight for moving the conference, or for at least protesting the conference presence in the US, gives us a whole lot to work with. And it also gives us a whole lot of more unnecessary work to do when we already have some serious challenges that will be in our face in 2020. Right now, we think 2018 is important. 2020 is, it's about life and death.
Thank you, Dazon. Hold on just a minute. Woo, we could listen to that all day. I wanted to get back to Andy to see, are there questions in the chat box, or can I give the final question? How do you want to do this, Andy?
Because there's one question that wasn't addressed yet, and I did tell the person that I would throw it to all of you. Michael Luella asks, who can we contact to voice our concerns? Are there funders to whom that we might individually and collectively send our thoughts about the current plans around AIDS 2020? Obviously, we can contact International AIDS Society, but are there other avenues that people have? And I'm putting our sign-on letter in the chat box for folks to see. But are there other things that other ideas that you all have?
Is that something we can wrap up in the last question of what should people do?
Yeah, can I take the first? I'll just start by saying that I see nothing to be gained from bringing the conference to the U.S. And I'll say that, knowing that, it was a significant thing for it to come to the U.S. in 2012. It did, in some ways, the organizer did result in, the lifting of the HIV travel ban. But I want to remind everyone that that was the conference when U.S. politicians announced the end of AIDS, and the ramp up of global circumcision programs, which as a man of color wouldn't be the first intervention I'd reach for. And so I just can't see that anything positive coming from bringing the conference to the US, particularly in 2020, at the end of a Trump administration and in a presidential election cycle. I'd also say to the question about funders, they changed from conference to conference, but we could reasonably anticipate that the NIH would be a big funder to the conference coming to the US, the CDC, US PEPFAR through USAID primarily, all agencies that you can write to directly, Chevron, Gilead, big corporate sponsors in previous conferences, and because they're headquartered in the Bay Area, I would imagine would be continuing sponsors to the International AIDS Conference. And then I'm trying to myself to get my hands on an email list of the International AIDS Society's governing council members. I know a few of them, but that information is not public. I'm trying to get it leaked. And as soon as I have that, I'll share that with the list here.
Thank you, George. Anyone else wants to answer that? What would you, what could some of your constituents, or what things can people do to join this movement, stand up in opposition, research? We have Larry, Dazon, and Kelly, if you guys want to comment. Final question.
Kelly, I believe you're muted.
You're muted, sweetie.
There we go. So I was happy earlier to hear Dazon talk about standing in solidarity with people who trade sex and people who use drugs, because it was such a fight last time. And I do think that, like, we need to call to the mat not just foundations, but also those partners who are in San Francisco and even across the country, who community-based organizations that want the conference here. You cannot be working on issues related to HIV and not have the global South here, and not be accountable to those who are most disproportionately impacted, to not be accountable to Black folks, to not be accountable to immigrants, to not be accountable to people who trade sex, to not be accountable to people who use drugs, to trans folks. It is egregious. And I think that we just don't let them get away with it. You know, the last time it was a fight, it was something that was new. I understood at the time the HIV ban had been lifted. I knew it was going to be a tough fight, but we are in a different position with a different administration. And at least the previous administration was willing to do as much as possible to try to get people in the country to try to work with people who use drugs and people who trade sex. But right now, I actually think that we need to call to the mat those community-based partners who are fine with having the conference here. Because if they're fine with having the conference here, they shouldn't have the bases that they have. They shouldn't have the clients that they have. They shouldn't have the participants that they have. They actually have to be working in a different way. They can't actually stand on the sidelines anymore. Like, we are not in a position in this day and time in this country where, like, right now, to be standing on the sidelines and to not stand in solidarity with each other. And so I actually think that we need to be building a list of those community-based organizations who are extremely excited about having the conference here, add to that foundations, and start to call them and hold them accountable, and not to out them, because you can't actually be on the sidelines or posting on Facebook or whatever you're doing, talking about Trump and the travel ban and like the Muslim ban and what's happening to immigrants at the border, without actually acknowledging that this conference cannot be in this country.
And
So,
Kelly, and if I can add to what Kelly's just said, we should be specific about which organizations we're talking about. And at the local level, I'd start with the San Francisco AIDS Foundation. On the conference coordinating committee, there are 3 permanent civil society partners who stayed silent. And those include the International Council of AIDS Service Organizations based in Toronto, the International Community of Women Living with HIV, and the Global Network of People Living with HIV, permanent partners of the CCC who've remained silent on this issue.
ICW?
Well, ICW, actually, let me correct myself. They were early supporters of moving the conference out of the United States. Since then, they're in transition and are without an executive director and have become silent.
Okay, Larry, I won't forget you again. Any final words about what folks can do, Larry, if they want to stand in opposition? Thank you, Kelly. I thought those were some good ideas as well, and George. Larry,
well, definitely. What I'm telling my network is, if they have strong feelings about this, that they can sign on to the letter that was prepared by the caucus. But then also, similar to what was said, writing the partner agencies in the Bay Area to voice their concerns, but then also supporting agencies that are not supporting the conference. Support the effort, that the alternative effort. Convene these conversations in your local areas. I've been telling Black gay men living with HIV for the longest time, we can't wait to have these conversations once or twice a year. We have to always have these conversations around saving our own lives. So continuing doing that as well.
Wow, thank you. I love that. And remembering too, the main focus of this webinar, I mean, there's a lot of reasons to oppose, but we're also talking about that, you know, we're bringing this from a racial justice perspective and our opposition. There's a number of oppositions, but racial justice is the one we wanted to highlight here, and clearly there are a number of others. So, Andy, any more questions out there we need to take, or any more comments?
There aren't any more questions, but I did want to point out that one of the reasons we timed this was to have a community conversation going into USCA so that people would be able to hear different points of view. You're going to hear a lot if you're going to the US Conference on AIDS. You're going to hear a lot for this conference, and we wanted to make sure that there was space for our voices too, so that people could hear what the conversation is the counter conversation happening. And I encourage everyone who's in the chat, everyone who's attended, to be able to carry this forward at USCA and maybe ask questions about, you know, that you're just not for for AIDS 2020 in San Francisco, and these are the reasons why, and you've heard great ones.
Vanita, this is Dazon having one of her moments, and I'm hoping that this conversation will also generate a lot more at USCA as well. Thanks for that, Andy. But I just want to throw in, because this is what Dazon does if you know me. We had a conversation about the fact that the words have power, and using the word alternative isn't comfortable with a lot of us in terms of calling whatever the next meeting that's not the IAC, but the people's meeting. And that's why we're, you know, AIDS2020ForAll. So may I offer that when we say this word, that we're actually saying ALLTURNUPTIVE, alternative. So we're going to have an alternative conference. We're not having an alternative conference.
I'm with that. I am with that.
Wait,
enough said.
Oh, I love
alternative.
You know I love it.
Yes.
This is what I do. If I had another purpose in life, that would be the money-making side of my life.
Okay, but find us a song too. We need the right song.
I really love that, Dazon.
Songwriter in our group. I'm sure there's a songwriter in our midst. What'd you say, George? I'm sorry.
No, I really love that, and it's a point well taken, and it's a point that we've been in discussion about with our global partners. And one of the working titles for another kind of gathering is One Room, One Table, which came from the round table discussion we had at the end of AIDS 2018 from Raoul Franson, who's just beside himself about how far away the International AIDS Society has moved from community perspectives and community ownership. And I think, you know, you know, just some closing kind of thoughts here. I think, you know, we've been able to illustrate in this conversation why this issue is a racial justice issue. And I think for me, it's always important to remind ourselves about where the majority of people living with HIV live. And they live in the global South. And that's Latin America, that's the Caribbean, that's Africa, that's Asia. And, you know, if we keep having these big conferences in the global North, it really cuts short an opportunity to have the conversations where the epidemic is happening. And I think it's important for us to come back to that. I also think, Dazon, your comments remind me that this is as much an intersectional issue as it is a racial justice issue, right? Because not only are we talking about racial justice, we're talking about sexual justice and economic justice.
Right.
And, you know, the ways that we can imagine a different kind of convening or gathering has to, you know, really elevate the intersectionality of this issue. So yeah, I mean, if you're queer, if you're a sex worker, if you're a person who uses drugs, if you're transgender, I mean, I think those things, those are really important things, especially if you're living in the U.S. and you have to live with a daily sense of of danger and vulnerability as a result of the shifting politics in this country.
Great point, George. I just wanted to clarify something that people had brought into the chat box, and that was the mention of the HIV travel ban. There is no current travel ban in the US. It was an Obama decision. It was an Obama administration decision to remove the HIV travel ban, which is how we, one of the reasons why the conference was here in 2012. What Dazon was referring to was that the current administration has been repealing a lot of Obama era policies, and to be mindful of that.
Right. Because it was originally done by executive order. And so to remove the threat to it changing every time, just like the Mexico City rule right now, because it has not yet been legislated, it's still an executive order which can come and go depending on who's in the White House. And so Congress actually did pass legislation to secure the removal of travel ban for HIV, but all I'm saying is the man has no respect for whatever laws we have. And so that's the possibility. What, Andy, there was also a request directly to clarify things. I think there was a question around what's asked in the travel ban and that there needed to be clarification. Is that the clarification that we just made? Amanda, I just want to make sure that we're answering Amanda's question around clarifying the travel ban versus the conversation about visas. I thought there was a different question around that. So I just want to make sure that people aren't confused about what types of visas you're talking about, where people have to declare their HIV status or declare that they're sex workers in the last decade or so, or declare that they're people who inject drugs or drug users. Can you clarify that very quickly?
Yeah, so there's been several questions around the visa issue, and basically when people apply into the US, we've been putting information in the chat boxes as well as in the Q&A where people can get more information. And if it seems confusing to folks, it's because it is. Visa applications, depending on what country you're from, often require a local bank account in your name. It requires a full-time job and proof of it to prove that that you won't stay in the US. Also, it asks for criminal records and social media handles to look you up. And so many of the ways that people are caught and denied visas or identified as sex workers is because of a criminal record, or identified as people who use drugs is because of these records that are kept on us and are used across surveillance systems to make sure that, to discipline us. And so for those of us with criminal histories, that follows us in the visa process.
Thank you. I just want to make sure that hit it. What Amanda's concern was making sure that people got the right information, especially because we know we have folks from outside the US on today's webinar.
Yeah.
Well, are there any more questions? I so appreciate you guys taking the time to do this. Always.
Yeah, thank you to the amazing panelists. You've all been great. Are there any other questions that people have? Any last comments from the panelists?
I like, what's that? All turn up, what is it? All turn up.
Alternative.
Alternative.
Don't get it wrong. All turn up.
Right. I don't want to get it wrong. I mean, shoot. All right, you all. Thank you so much.
All right. Love you all. Keep up the great work.
Thank you so much. Take care of yourselves.
Triple D, I love you.
Mwah. Struggle well. Struggle well.
I love.
Always. Bye-bye, y'all.
Bye.